Yes, villagers. Today we're going to be talking about 4 things that you didn't know about mental health. So if you want to find out if your view is reflected among the 4, you are in the right place. If you're new to this channel, welcome to our village. If you're a returning villager, welcome as well. So let's get into it. Welcome to Garden of the Mind, where we reduce stress, improve our health and fitness, and improve our financial IQ every episode. These days you hear so much about mental health. However, while the public seems to be emerging in terms of their knowledge, there's still a lot that the public does not know. We're going to be talking about some of them. Item number 1. What is mental health? Well, I define mental health as being able to deal with life circumstances without raising your anxiety level. I look at your mental health as if it's a balloon. The more you blow into it, the less capacity you have to deal with regular life situations. The more you blow into it, the closer it gets to popping. If your individual balloon pops at a 10, you don't want to blow as much air into it because you know that you only have a certain finite storage there. So if you're already at a 3 and you know that you're going to pop or explode at 10, then you want to stop before you get to about an 8. Now, it would be absolutely wonderful if we all knew what our threshold or number was. Most of the times we don't know that because that number also changes depending on the variety of factors that we have already dealt with. So at age 20, you might have a storage capacity of a 15, but later on at age 35, you might only have a storage capacity at 10. Your storage capacity fluctuates from time to time and from event to event. Item number 2, what contributes to negative mental health? I believe that what contributes to negative mental health is trauma. And I like the Oprah Winfrey definition of trauma, which says that once you experience it, you cannot go back to the person that you were prior to the trauma. Now, trauma can be different things to different people. What is traumatic to one person may not be traumatic to another person. So it's an individual type of thing. But there are certain things that are universally traumatic to most people, which is if you watch someone get murdered. Now, there is a screening system called ACEs, which stands for Adverse Childhood Experiences. They have a wonderful screening which details some of the events that appear to be traumatic for most people. Those things can be if you experienced a fire, if you were sexually abused, if you were mentally abused, if you were physically abused. All of these things can be very traumatic and have repercussions in terms of your mental health. So back to the balloon that I was talking about. If you have any of these things, then they already contain a certain level of space in your balloon. Now, let's say you were physically abused. That may contribute 3 points in your balloon, which only holds 10. So unaddressed trauma holds a certain portion in your balloon or your threshold, and other things get added to it, and then you are closer to exploding because that trauma was never dealt with. Item number 3, what contributes to positive mental health? This is a situation that depends from person to person, and that list can be exhaustive. But some of the things that I can think of right off the bat are exercise, self-care, psychotherapy, among others. All of those things have to be done specifically to counteract some of the damage that has been done from these levels of trauma. Item number 4, how to monitor your mental health. One of the best ways to monitor your mental health is pay attention to the content of what it is that you speak about. Think about what you say, even in joking. So let's say you joke around a lot with violent references. Sometimes that can symbolize that something is bothering you that you would really like to rectify. Do you have a lot of complaints about other people's actions? Now, these are just general questions. However, there are some more specific questions that really highlight whether you might have a diagnosis, like do you no longer enjoy things that you used to love once upon a time? There are various screeners out there that can gauge what your mental health is, even if it doesn't appear to be a problem for you. It may signify that there might be a greater problem that you may not be aware of. Now, with mental health, there are so many aspects that can't be included in a short 5-minute video. And if you find that there's a reoccurring issue or theme in a lot of the things that you say or do, then you might want to speak to someone on a professional basis. If you like this video, please give it the thumbs up. If you like this channel, please subscribe. If you want to know when I post, which is Wednesday, please click on that notification. You get that ding on your phone, and you know that a new video is waiting for you. And remember, thoughts are actions, words have power, and actions have consequences. I'll see you next Wednesday. I'll see you then.